terang juga nyampe. Goblok. Ikan. Assalamualaikum.
Waalaikumsalam.
Still 4-5 students left.
Yes, it's okay, sir. We can.
Okay, we can start. Yesterday we done with the uses of Atropine. Phenol and carbachol. These drugs were directly acting. Yesterday we also done one drug, pyridostigmine, indirect acting. This pyridostigmine we use for myasthenia gravis. Who can answer about cholinergic agonist and myasthenia gravis differentiation? Yesterday I gave this homework. Who can answer about cholinergic agonist? What means cholinergic agonist? How you can differentiate it from myasthenia gravis? Anyone?
Let me try, sir.
Yeah.
For what I know, the cholinergic crisis is called. It is due to the intoxication of the acetylcholine esterase inhibitor.
Yeah. Okay. This means acetylcholine is become very high at neuromuscular junction. Okay. So if you use acetylcholinesterase inhibitor, if overdose, the patient taking too much high concentration drug, then what happens? Too much blockage of acetylcholinesterase enzyme, acetylcholine level too high. Okay. So which receptor present in neuromuscular junction with an NM? N nicotinic receptor. Yeah. On smooth muscle was M3 receptor. So NM receptor, this receptor, it gives response to acetylcholine very quickly. Okay, it gives response very quickly. But if you again and again stimulate this NM receptor undergo inactivation. The receptor not give much better response. Okay, inactivation of receptor, it means no response. No response. Okay, so in pharmacology we use one term, tachyphylaxis. Write this term, tachyphylaxis. Okay, so what is tachyphylaxis? Tachyphylaxis means no response given by receptor. Okay, acetylcholine, if acetylcholine here very high concentration, yeah, which enzyme we use here? Acetylcholine esterase enzyme. Yeah, so now you use drug to block it. Which drug we use? Pyridostigmine, acetylcholine esterase inhibitor. Okay, pyrido, for example, pyridostigmine, this drug. If you use this drug in very high concentration, what happens? This enzyme block for longer duration. So in this synapse, acetylcholine level very high. Acetylcholine level very high. This phenomena known as cholinergic crisis. Okay, acetylcholine in synapse very high in concentration. Okay, so if this acetylcholine is very high in concentration, this acetylcholine again and again attached to receptor. Okay, again and again try to stimulate the receptor. This nicotinic receptor is not attached with G protein. I already explained all the M receptors they having the protein like GQ protein, M2 receptor, for example, GI protein. Okay, the second messenger system we use for M3 receptor to give signal inside the cell. We're using G protein system. Okay, the G protein system not give very rapid response. Okay, as compared to ion channel. So nicotinic receptor attached with ion channel. Nicotinic receptor attached with ion channel. Which receptor? Ion channel, and this gate is sodium gate. The sodium gate attached with this receptor. Okay. So the ion channel, if a receptor having ion channel, the ion channel receptor they give very quick response. But if you again and again and stimulate that receptor, what happens with the receptor? Tachyphylaxis. What is tachyphylaxis? No more response given by receptor. Clear? So repetition. If you stimulate the receptor again and again, receptor become inactive. Receptor become inactive. Clear? This the definition of tachyphylaxis. No response given by receptor. So this happen in cholinergic crisis. Clear? Very high concentration of acetylcholine. Stimulate the receptor again and again. Receptor become inactive. Understand? If receptor again become inactive, this patient, okay, we again consider the patient myasthenia gravis patient. The myasthenia gravis patient, what you give to patient? So first to diagnose myasthenia gravis, we use drug Hydrophonium. This we done yesterday, yeah? Hydrophonium. This Hydrophonium is short-acting drug. Hydrophonium, short-acting. The patient come to you with the muscle weakness. In the myasthenia gravis, where is the muscle weakness start in the body? The patient complain muscle weakness in the facial muscle, and the muscle weakness prominent in upper limb. Okay, only upper body. This muscle weakness start from face. Okay, the muscle of eyes and muscle of the remaining face, the facial expression muscle. The patient complain muscle weakness in the facial part, muscle weakness in upper limb. Now, to diagnose this disease, if you're thinking about the myasthenia gravis, you give Hydrophonium. Okay. Then what happened to patient? The patient said, I am now feeling better. The muscle contraction improve. Okay. Muscle contraction improve. This one clear? If the muscle contraction improve by giving Hydrophonium, it means the patient now having it's a myasthenia gravis disease. This test, the name of test, Penicillin test. It's a penicillin test, okay? Name of this test used to diagnose myasthenia gravis. We use drug Hydrophonium, okay? We use drug Hydrophonium. The patient, the muscle contraction improve by using Hydrophonium. Clear? So what the Hydrophonium is doing? Hydrophonium block this enzyme, yeah? Same action. Hydrophonium also block this enzyme. Acetylcholine level increase. If acetylcholine level increase, then what happens? Contraction there. Understand? Contraction there. Then you give treatment to patient. So what treatment you give to patient? To use here pyridostigmine. Pyridostigmine we use for myasthenia gravis. The patient, okay, after few days, listen here carefully. You advise this patient to use this drug in morning, evening, one time, two time, like this. Okay. So if the patient again come after 1 week, again complain, I am again having weakness. Using medication for a few days, okay? 4 or 5 days patient, you give medication. Which medication? Pyridostigmine. Then after few days again complain muscle weakness. Okay? Again complain muscle weakness. What happened to the patient now? The patient may take, what you thinking now? You already give pyridostigmine. Understand? You already give pyridostigmine. This patient, the muscle contraction must be improved. But why this pyridostigmine again causing muscle weakness? Patient again have same complaint. Okay? Now this patient using overdose. This patient already taken overdose. This patient using pyridostigmine in a very high concentration. What happened with the acetylcholine level? Acetylcholine level is now very high. Okay. If acetylcholine level very high, it's known as now patient not suffering from myasthenia. You already give treatment for myasthenia gravis. Now patient having cholinergic crisis. Understand? Patient now having cholinergic crisis. A very high level of acetylcholine block nicotinic receptor. The patient already taken overdose. Done? Okay. This patient already visited one doctor. Yes. Already visit one doctor. Now that patient is not much improving in muscle contraction. Then again visit another doctor, but not give proper history. Already using medication for this disease. Now patient come to you again having muscle weakness. Not give previous history. Already eaten this drug, pyridostigmine or not. Yeah, you give Hydrophonium because you just thinking about, oh, you have facial muscle weakness, you have upper limb muscle weakness. Clear? You may have myasthenia gravis. You give Hydrophonium. Again give Hydrophonium. If patient having Hydrophonium in myasthenia gravis, this contraction, the patient contraction improve. Muscle contraction improve. Patient give response to Hydrophonium. If patient suffer from cholinergic crisis, then can muscle contraction improve with Hydrophonium? Of course not. Why? Because in cholinergic crisis already acetylcholine very high. You don't know about the patient already taken medication or not. Yeah, patient come to you with the complaint of facial muscle weakness. Yeah, with the upper limb muscle weakness. Patient again complain. If patient already give history, yeah, I already use this medication, then it's very easy for you to diagnose this condition. Yeah. So it's a difference between myasthenia gravis and cholinergic crisis. If you use Hydrophonium in myasthenia gravis patient, then the contraction will be improved. If patient have cholinergic crisis issue, then contraction, no response. Patient gave no response to Hydrophonium. Patient still have weakness. Then no need to use pyridostigmine again. Okay. If patient suffer from cholinergic crisis, then no need to use again cholinergic agonist drug. Here we need another drug to decrease the acetylcholine. Okay, we can use here drug. Let I explain in antagonist group. Curare family drug. Curare family, Atracurarium, Mivacurium. Later we learn in antagonist group. Okay, the Curare family is this drug against acetylcholine. It can block the receptor because overstimulation there. Yeah, because of overstimulation there. So in case of cholinergic crisis, not need to use again pyridostigmine. Okay. So what are the uses of Hydrophonium here now? Hydrophonium we use to diagnose myasthenia gravis. Number one use. Yeah. Another use, second use, we can use this Hydrophonium to differentiate myasthenia gravis from cholinergic crisis. Understand? Number one use of Hydrophonium, diagnose myasthenia gravis. Yeah. And second use of Hydrophonium, we use Hydrophonium to differentiate myasthenia gravis from cholinergic crisis. If patient have already using acetylcholine esterase inhibitor in very high concentration, that time patient suffer from cholinergic crisis. Okay, cholinergic crisis. This is a use for pyridostigmine. Understand about the pyridostigmine? It's a long-acting drug we use for myasthenia gravis. Before using this, must give Hydrophonium. This test is Tensilan. This name is Tensilan. Tensilan test nowadays is not much useful to diagnose. The second test, the first test we use for diagnosis of myasthenia gravis, the first in the previous time, the Tensilan test. In Tensilan test, we just give Hydrophonium or contraction improve, or myasthenia gravis not improve. It may be Guillain-Barré syndrome, it may be Eaton-Lambert syndrome. Okay, the Tensilan test is now rarely used. What's the most accurate test to diagnose myasthenia gravis? We find out antibody against acetylcholine receptor. Okay, so this test is now definitive test, confirmatory test to diagnose myasthenia gravis. This test will confirm. Okay, Tensilan test was old test to diagnose myasthenia gravis. These both tests are effective. First, we can, if you want to confirm this disease, you need to perform the test antibody. You must find out antibody against acetylcholine receptor. Okay. The basic idea about myasthenia gravis diagnosis and treatment done. Are
Yes,
guys
sir.
clear about myasthenia gravis treatment?
Yes, sir.
How you can differentiate? How you can differentiate the cholinergic crisis? What means cholinergic crisis? Cholinergic crisis is just a high level of acetylcholine in synaptic space. Okay, so too much acetylcholine inactivate the receptor like nicotinic receptor. Nicotinic receptor, if you repeatedly stimulate nicotinic receptor, that receptor become inactive very quickly. Yeah, that phenomenon known as tachyphylaxis. Okay, what are the remaining drugs? Next drug, rivastigmine. Rivastigmine, heparin, glutamine, donepezil. These drugs have ability to enter CNS. These drugs, they have ability to cross blood-brain barrier. They easily can penetrate CNS. Yeah. So what are these drugs? Again, same group. Acetylcholine esterase inhibitor. What they are doing? They indirectly increasing the level of acetylcholine inside the CNS. Increase the level of acetylcholine inside the CNS. So now we can use for which disease? Alzheimer disease. What happened inside the Alzheimer disease? In Alzheimer disease, the patient have problem in this brain, the temporal lobe, the frontal lobe. These two parts very important for memory. Okay, the storage. In Alzheimer disease, the patient having two problems. Number one, amnesia. Number two, dementia. Amnesia and dementia. What is amnesia? It's just a short-term memory loss. Patient not able to recall previous information. Patient not able to recall new information, to learn new information. Amnesia. Okay. The amnesia have two types. Number one, retrograde. Retro means behind. Okay. It's mean if you have any, for example, you memorize something. Okay. You learn one subject. I'm asking question from the previous topic and you're not able to recall. Okay. So if patient not able to recall previous memory, it's known as retrograde amnesia. Okay. If patient not able to learn new information, anterograde amnesia. And anti mean forward. Okay. Anterograde. Anti mean forward. Retro mean behind. If the patient have the lay and the problem in temporal lobe, this is temporal lobe of the patient. Okay, the brain. In temporal lobe, acetylcholine decrease. Yeah, in temporal lobe, acetylcholine decrease. Now the patient having problem amnesia. Understand? If the problem in temporal lobe, then amnesia. If you have problem in frontal lobe, acetylcholine decrease in frontal lobe. Understand? Acetylcholine decrease in frontal lobe. The acetylcholine decrease in frontal lobe. Then patient having problem dementia. What is dementia? Dementia means permanent loss of memory. What is dementia? Permanent loss. This memory never come back. Permanent loss. Okay. Now you can see in this patient, in Alzheimer disease patient, what the problem in Alzheimer disease? In Alzheimer disease, we having cholinergic neurons. Okay. Cholinergic neuron there. Okay. The death of cholinergic neuron die. Death of cholinergic neuron. If cholinergic neuron, cholinergic neuron producing acetylcholine, this we know, yeah. So inside the brain, cholinergic neuron die. If cholinergic neuron die inside the temporal lobe, then problem with recalling to recall something, and problem with learn new memory. Understand? It's known as amnesia. If the death of the neuron inside the frontal brain, then permanent loss of memory is dementia. The permanent loss of memory is dementia. Understand? So if you use these drugs going in brain, yeah. So they're doing what? Increase acetylcholine. Understand? They increase acetylcholine. So they can improve amnesia. They can improve dementia. These drugs can slow down the disease, slow down the progression of disease. Okay. Alzheimer disease, the disease of elder person. This is elder person, the age group 60 to 70. The age group of the patient. Clear? The elder person, they have problem with forgetting everything. Yeah. Why? Because of aging, these neurons die. Cholinergic neuron. Death of cholinergic neuron. This cholinergic neuron decrease in brain. Yeah. If in frontal brain, then dementia, permanent loss. If in temporal lobe, then problem with amnesia. Problem with the short-term memory. Problem with recalling of previous information. Clear? And learning new information is the issue. So these drugs we use for rivastigmine, tacrine, galantamine, donepezil. This drug has some problem. Keep in mind this drug, tacrine causing liver damage. So this drug nowadays we not use for this Alzheimer disease. Tacrine have problem to damage the liver, hepatitis. Tacrine causing what? Hepatitis. So little use for this drug. So we having still rivastigmine, galantamine, and donepezil. Understand? So what happened in Alzheimer disease? Death of cholinergic neuron. Understand? Cholinergic neuron die. So can you reverse this process? Of course not. You just can improve symptom. You just can increase acetylcholine. Okay. So in combination with these drugs, write another drug, memantine. Memantine. Okay. So another drug. This drug decrease the rate of neuron death. Decrease the rate of neuron death. So it means this drug, memantine drug, it can stop the progression. Okay. What happens in Alzheimer disease? Death of cholinergic neuron. So if you stop the death of cholinergic neuron, so it means no more death of cholinergic neuron, memantine. Yeah. So in combination with rivastigmine, tacrine, galantamine, then donepezil. So these drugs doing what? They increase acetylcholine. And how about this drug, memantine? Memantine help to decrease the rate of death. Yeah. So neuron, the death of neuron decrease. The damage to injury to neuron decrease by using memantine. So in combination with these drugs, we also can apply memantine. This is a full treatment for Alzheimer disease. Okay. In Alzheimer disease, we use rivastigmine, tacrine, galantamine, donepezil, and memantine. Clear?
Clear, sir.
Clear? Okay. So uses of rivastigmine and tacrine and galantamine. What is the use for ecothiopate? Another drug, irreversible irreversible acting, ecothiopate. Okay, ecothiopate. This drug completely block. What is this drug name? It belongs to acetylcholine esterase inhibitor. Yeah, but this drug irreversible. Irreversible. This we know. Yeah, this drug only have eye uses. This drug we use for chronic glaucoma. This drug we use for chronic glaucoma. In chronic glaucoma patient. In emergency glaucoma, acute glaucoma, which drug we use? The preference must keep in mind. Ecothiopate. If patient have chronic glaucoma, slowly eosinophil pressure is building up inside the eye, then we can apply drug, slowly acting drug, ecothiopate. Okay? Ecothiopate we use for chronic glaucoma. Okay? Now the next clinical topic, clinical things about cholinergic system. Another topic. This is a new topic, okay? But related with this drug, organophosphate poisoning. Organophosphate. May you have pesticide, insecticide at your home. Pesticide. Organophosphate present in pesticides, insecticides. Okay. You know fertilizers. Yeah? Fertilizer. The fertilizer we use for field, for crops. Yeah. They are mostly insecticide and pesticide. These insecticide and pesticide, the chemical formula, these are the organic phosphates. They contain organic phosphate. These are organophosphate. So organophosphate, if enter the body, it's known as OP. Organophosphate enter your body. Opiate. OP is organophosphate poisoning. Okay, organophosphate poisoning. What happened inside your body? It's a toxin. Yeah, it's not good for body. Organophosphate. This organophosphate doing what? Enter your body. Okay. This organophosphate acting on enzyme. Which enzyme? Acetylcholine esterase. This enzyme block. If organophosphate enter your body, acetylcholine esterase enzyme block. Okay. Acetylcholine esterase enzyme block. If this enzyme block, then what happens with acetylcholine? Acetylcholine level increase. Clear? What happen in patient? If some person drinks some pesticide, insecticide, just to try for attempt for suicide, yeah, for suicidal attempt, just drink or eat pesticide and insecticide. So it's organophosphate. In the mostly villages and towns, this thing happen. For the person try for. Sometimes children accidentally, you at your home you have insecticide or pesticide, yeah, and sometimes children they take, they eat. Understand? So what happened in the patient? First, you need to understand what happened in the patient. What is sign symptom of the patient? What happened with the heart? What happened with heart? Do you know heart receptor? M2. What you doing now? Increase acetylcholine, yeah? So if you increase acetylcholine, what happened with heart rate? Going down. Okay. The receptor on the vessel causing acetylcholine, indirectly causing vasodilation. Indirectly. Acetylcholine receptor not present on vessel directly, not causing vasodilation directly. Indirectly, okay? Acetylcholine causing vasodilation, decrease blood pressure. Clear? It's an effect on heart rate. Okay. Effect on heart. What happened with respiratory system? Respiratory system, bronchoconstriction. Respiratory system, bronchoconstriction. M3 receptor causing, because too much high acetylcholine in the body, clear? Bronchoconstriction. If bronchoconstriction, then air can enter the airways. Oh, it's very hard, yeah? The problem with difficulty in breathing also. Difficulty in breathing, clear? difficulty in breathing. What happened with the GIT? What happened with GIT? Peristalsis increase. It lead to diarrhea. Okay. Patient have poisoning, organophosphate poisoning. Clear? Heart rate decrease, blood pressure decrease, difficulty in breathing. Okay. Peristalsis increase, diarrhea. What happened with unibladder? Bladder contraction. Why empty this? You know, yeah. Urination, increase urination. Clear? Increase urination, the micturition increase. Why? Bladder contraction there. Okay, what happened with the gland? M3 receptor gland. Oh, watery eye. Because too much water from the eye, lacrimation. Yeah, watery eye. From the mouth, salivation. Full body, sweating. All these functions are increased because all these functions belongs to parasympathetic system. Parasympathetic system working by using acetylcholine. Now acetylcholine level very high in body after organophosphate poisoning. Understand? So how a patient dies? The patient dies because of cardiac arrest, blood pressure going down. Understand? It's an effect of organophosphate in our body. The effect of organophosphate in our body: heart rate decrease, blood pressure decrease, bronchoconstriction, difficulty in breathing, diarrhea, increased urination, micturition, watering eye, salivation, sweating. Understand? These are the effects. Okay. So if you want to save the life of the patient, you need what? You need to block this. Yeah. Because very high level of acetylcholine now. What happened with the muscle? Muscle under cholinergic crisis, also muscle weakness there, because very high level of acetylcholine in our full body. Yeah? If you need to now, you need to block this acetylcholine. Later we learn about antagonist. Okay, so very good drug here. In emergency situation we use atropine. Later we learn this drug in next topic. Okay, this atropine is cholinergic antagonist. Okay, if any patient having organophosphate poisoning, organophosphate poisoning. So organophosphate poisoning doing what? Increase acetylcholine. Okay, increase acetylcholine level. Why? Because they block this enzyme. Understand? They block this enzyme. So if you want to save the life of patient, you must block this acetylcholine. You must block this acetylcholine. Understand? Must block the action on heart. You can save heart. Done? So because very high level of acetylcholine. So organophosphate doing what? Another clinical point. Spider venom. Spider. Spider venom. Yeah? This spider is very special spider. Black widow spider. Black widow. Black widow spider. Okay. Only present in Africa. Black widow spider. This spider doing what? If patient having sting, having bite by this spider, black widow spider, the venom of this spider enter your body. Okay, this venom doing what? This venom releasing acetylcholine. So acetylcholine, here we're having acetylcholine presynaptic space. Yeah, it's a synaptic space, the postsynaptic membrane. So after spider venom, when spider venom enter your body, patient having the sting bite, okay, by the spider, black widow spider, this venom, the spider doing what? Increase the release of acetylcholine, okay, increase the release of acetylcholine. This venom doing what? This venom increase what? Acetylcholine release very high. If very high, again what happened? What happened to patient? Decrease heart rate, decrease blood pressure, difficulty in breathing, diarrhea, urination, watery eye, salivation. Okay, understand? If you have scorpion bite, snake bite, so these bites, these are the venom, scorpion venom. These things, all these things, they increase parasympathetic activity. Mostly their venom activate parasympathetic system. Okay.
Sir, we
Still here clear?
yes. Time for restart the class, sir. The room.
Okay. Again.
Okay. Okay, guys, restart, guys.